Doctor, the management of cataracts is designed to do what? It is designed to correct visual impairment and maintain or improve the quality of life and to prevent the progression of a lens cloudiness. Doctor, what about the removal of the diseased lens and replacing it with an artificial intraocular lens in the treatment of this disease? Well, if both eyes are affected, they are usually operated on separately, as this reduces the risk of a complication, such as infection, affecting vision in both eyes at the same time. Doctor, within the eye, the lens is contained within a clear, elastic, bag-like structure called the capsule. Is that correct? That is correct. Doctor, is the capsule attached to a strong suspensory ligament that holds the lens in place in front of the pupil, or does it not? Yes, that is a correct statement. During traditional cataract surgery, the entire lens was removed together with its capsule. This is known as intracapsular cataract extraction, or ICCE. It is even rarely performed now. And it has been replaced by what? It has been replaced by extracapsular cataract extraction. And that is where the lens is removed, is it, doctor? Yes, it is through a small opening in the front of the capsule. Doctor, does this leave the posterior part of the capsule in place as a convenient bag into which a new lens may be inserted? Yes, that is correct. This, in turn, has been now largely superseded by a third surgical optical option called photo or phaco emulsification, or phaco for short, from the Greek word phakos, meaning lens. Doctor, phaco means lens in Latin? No, in Greek it means lens. Is it similar to ECCE? Well, in that the lens is removed and through an opening in the capsule, which is left behind. And rather than naming it for the removal of the lens, doctor, however, it is fragmented, is it? Yes, it is fragmented, and using ultrasound and removal by sucking it out through a needle. Doctor, what is phaco emulsification, or ECCE? Phaco emulsification is used whenever possible, as they involve smaller incisions. That ICCE, less risk is involved of completeness or complications, more rapid wound healing, and faster return of acceptable visibility. Doctor, the phaco is the treatment of choice, is it? Yes, as only a tiny wound is produced that often does not need sutures. As the wound is so small, a foldable artificial lens is rolled up and inserted with the phaco. Doctor, while a non-foldable lens is replaced through the larger incision produced during ECCE, is that right? During surgery, you will lie on an operating table or sit back in a reclining chair. Your eyelid is swabbed with antiseptic solution and your face covered with a sterile cloth that has an eye-shaped opening through which the surgeon operates. Doctor, the eye drops are instilled 30 to 60 minutes before surgery to constrict blood vessels. That is correct, which reduces bleeding, and to maximally dilate the iris the colored part of the eye. This produces a wide pupil which makes removal of the lens easier. And sedation is usually given orally or into a vein to reduce anxiety, and it may mean that you remember little of the procedure afterward. That is correct.